First time in over 6 weeks, Illinois reporting over 3,000 new cases of COVID-19. Here's a look at the last 2 months of daily new cases, and that line is definitely trending upward for the past week. It is similar locally. These are the weekly new cases, which is definitely on a slight upward trend over the past 3 weeks. Yesterday, Peoria's health watchers said they believe the uptick is linked, at least in part, to youth sports. This week, some football teams have canceled games because a player tested positive. But the IHSA says they don't force teams to cancel, and their guidance doesn't have a concrete cancellation policy.
We don't have the medical expertise within our office to provide that guidance, and so our correspondence to our schools is that they work with local health departments and then anybody locally within their school.
One public health expert says it's hard to reduce the risk from youth sports.
When you take on these sports, you take on that full risk. And so it's going to be a decision between school boards and their ADs and those parents as individual students.
At least 5 football games in our area were canceled or postponed tonight because of COVID infections confirmed this week.
McLean County is reporting 30 more COVID deaths. The health department says it just reviewed COVID data reports from the state from the past couple of months. And most of those additional deaths happened between November and January, when there was a large influx of reported deaths. After an audit, McLean County says it added 30 deaths to the previous count, bringing the total to 207. Peoria County did a similar review of data at the beginning of March and added 27 deaths. But vaccine numbers keep climbing. In central Illinois, more than 140,000 people are fully vaccinated. Peoria, Tazewell, and McLean counties have the highest concentration of those people. But look at the percentage of the population here. McLean County turns red because it has the lowest percentage of its population vaccinated than any other county in our viewing area at 13%. Now compare that to Peoria County, which is now at 20%. In some parts of Illinois, people 16 and older will become eligible for the COVID vaccine. And this week, more than 3,000 new cases were reported today. Public health leaders have also seen the demand for vaccines slow down in several counties, leaving appointments for the critical shots unfilled. Most of the people getting vaccinated are older. Governor Pritzker explained today that the average age for new cases and hospitalizations has gone down recently.
It's not that we're aiming specifically at a specific age group. We just want to make sure that we're vaccinating everybody that's vulnerable and then getting every vaccine dose out into people's arms as quickly as possible.
So could this impact the move to the bridge phase for reopening the state? While 67% of seniors are vaccinated, the state needs to make sure new hospitalizations and people in ICU beds aren't rising. However, that's where the state is seeing a surge right now.
Some people are still dealing with symptoms months after testing positive for COVID-19, and doctors are trying to find a way to help them. Andy Weber talked with one local woman dealing with these ongoing problems.
To get a better understanding of the long-haul experience, we turn to our viewers on Facebook to see what it's like to have COVID-19 symptoms so many months after the original positive test.
The first day I had a bad headache, and I get headaches sometimes, but the headache was a really bad headache. And then I felt really hot. I took my temperature, it was 102.
Mary Fullen says she tested positive back in January and struggled to get out of bed for weeks. While her most severe symptoms have subsided, she says she's a long hauler.
I am still very tired. I get out of breath really easy if I'm cleaning the house. I have to sit down every 5 or 10 minutes because I'm having trouble breathing.
COVID long haulers are people dealing with COVID-19 symptoms more than a month after their original diagnosis.
Overall, for people who have symptoms from COVID, I'd say 1 in 3 to 1 in 4 might end up with a long hauler symptom.
Dr. Mark Meeker with OSF Healthcare says those symptoms include fatigue, aches, cough, shortness of breath, and in 5% of long haulers, a brain fog that makes it hard to focus. Meeker says right now, basic rehab is proving to be an effective treatment.
Simple walking programs, you have to find that sweet spot. You need to push yourself a little bit, but not overdo. And then for the mental rehab, sometimes simple things like crossword puzzles, math problems.
For 25 News, I'm Andy Weber.